So, let's dive into our first topic, understanding the differences between type 1 and type 2 diabetes. It's crucial to know how these types differ, as well as their causes, risk factors, and how they affect the body's ability to produce and use insulin. Type 1 diabetes, which is sometimes referred to as juvenile diabetes, is an autoimmune condition. In this case, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas called beta cells. As a result, the pancreas is unable to produce enough insulin, which is the hormone responsible for regulating blood sugar levels. The exact cause of type 1 diabetes is still unknown. However, it is believed to involve a combination of genetic and environmental factors. Type 1 diabetes can develop at any age, but it's typically diagnosed in children, teenagers, or young adults. On the other hand, type 2 diabetes is primarily driven by lifestyle factors in genetics. In this type, the body either doesn't use insulin effectively, a condition known as insulin resistance, or it doesn't produce enough insulin to maintain normal blood sugar levels. Over time, the pancreas can become unable to keep up with the body's insulin needs, leading to elevated blood sugar levels. Type 2 diabetes is more commonly seen in adults, but with the rise in childhood obesity, it's becoming increasingly prevalent in younger individuals as well. Risk factors for type 1 diabetes include a family history of the condition, certain genetic factors, and exposure to specific viruses. In contrast, type 2 diabetes risk factors are often related to lifestyle choices, such as obesity, physical inactivity, poor diet, and a history of gestational diabetes during pregnancy. Genetic factors can also play a role in the development of type 2 diabetes. Now let's talk about how these types of diabetes affect the body's ability to produce and use insulin. In type 1 diabetes, the body produces little to no insulin, which means that glucose is unable to enter the cells and remains in the bloodstream. This leads to high blood sugar levels, which can cause various complications if left untreated. In type 2 diabetes, the body initially produces enough insulin, but the cells become resistant to its effects. This resistance forces the pancreas to produce even more insulin in an attempt to overcome the resistance and maintain normal blood sugar levels. Over time, this can lead to a decrease in insulin production, further exacerbating the problem and causing blood sugar levels to rise even higher. Understanding the differences between type 1 and type 2 diabetes is essential, as it helps us recognize their unique causes, risk factors, and the ways in which they affect the body's ability to produce and use insulin. In the next sections, we'll explore the role of glucose in the body and discuss the symptoms, warning signs, and potential long-term effects of unmanaged diabetes. Now that we've discussed the differences between type 1 and type 2 diabetes, let's explore the role of glucose in the body, how it's regulated by insulin, and why maintaining proper blood sugar levels is crucial for overall. Glucose is a simple sugar that serves as the primary source of energy for our cells. We obtain glucose from the foods we eat, particularly carbohydrates. Once consumed, carbohydrates are broken down into glucose, which then enters the bloodstream to be transported to the cells throughout the body. Insulin, which is produced by the pancreas, plays a critical role in regulating glucose levels in the bloodstream. When blood sugar levels rise, such as after a meal, the pancreas releases insulin. Insulin acts like a key, allowing glucose to enter the cells where it can be used for energy. As a result, blood sugar levels decrease, helping to maintain a healthy balance. Maintaining proper blood sugar levels is essential for overall health. When blood sugar levels are too high, a condition known as hypoglycemia, that can cause damage to blood vessels and nerves over time. This damage can lead to various complications, such as heart disease, kidney damage, vision loss, and even nerve damage, which can result in amputations. On the other hand, if blood sugar levels are too low, a condition called hypoglycemia, it can lead to dizziness, confusion, and even unconsciousness. That's why it's crucial to keep blood sugar levels within a healthy range. For people with diabetes, managing blood sugar levels is even more critical, since their bodies either don't produce enough insulin or don't use it effectively. They are at a higher risk of experiencing both hyperglycemia and hypoglycemia. By maintaining proper blood sugar levels through a combination of lifestyle changes, medications, and insulin therapy, individuals with diabetes can prevent or delay the onset of complications associated with the condition. In summary, glucose plays a vital role in providing energy for our cells, and insulin is essential for regulating blood sugar levels. Maintaining proper blood sugar levels is crucial for overall health and preventing diabetes complications, especially for those with diabetes. In the next section, we'll learn about the symptoms, warning signs, and potential long-term effects of unmanaged diabetes, emphasizing the importance of early detection and treatment. Moving on to our next topic. Let's learn about the symptoms, warning signs, and potential long-term effects of unmanaged diabetes. By understanding these, we can emphasize the importance of early detection and treatment to prevent complications. The symptoms of diabetes can vary depending on the type and severity of the condition. However, some common symptoms include increased thirst, frequent urination, fatigue, blurred vision, slow healing wounds, and unexplained weight loss. It's important to note that type 2 diabetes can develop gradually, and many people may not experience any symptoms at all, or they may be so mild that they go unnoticed. That's why regular checkups and blood sugar monitoring are essential, especially for those at risk. If diabetes is left unmanaged, it can lead to a wide range of long-term complications. High blood sugar levels can damage blood vessels and nerves, affecting various organs and systems in the body. Some of the potential complications include 1. Heart disease. Diabetes increases the risk of heart disease, stroke, and other cardiovascular problems due to damage to blood vessels and high blood pressure. To see if kidney damage. High blood sugar levels can harm the kidney's filtering system, potentially leading to kidney failure or end-stage renal disease, which may require dialysis or a kidney transplant. 3. Vision loss. Diabetes can cause damage to the blood vessels in the retina, leading to diabetic retinopathy, cataracts, or glaucoma, all of which can result in vision loss or blindness. 4. Nerve damage. High blood sugar levels can damage nerves, particularly in the legs and feet, causing pain, numbness, or a tingling sensation. Severe nerve damage can lead to amputation of the affected limbs. 5. Foot problems. Diabetes can cause poor blood flow and nerve damage in the feet, leading to ulcers, infections, and even amputations if left untreated. These complications highlight the importance of early detection and treatment. By managing blood sugar levels through lifestyle changes, medications, and insulin therapy, individuals with diabetes can significantly reduce their risk of developing these life-threatening complications. In summary, understanding the symptoms, warning signs, and potential long-term effects of unmanaged diabetes is crucial in emphasizing the importance of early detection and treatment. In the next section, we'll examine the various methods for managing and treating diabetes to help individuals maintain a healthy blood sugar level and prevent complications. Now that we've discussed the symptoms and potential long-term effects of unmanaged diabetes, let's examine the various methods for managing and treating this condition. Our goal here is to help individuals maintain a healthy blood sugar level and prevent complications. The management and treatment of diabetes depend on the type and severity of the condition. However, there are some common strategies that apply to both type 1 and type 2 diabetes. 1. Lifestyle changes. Eating a balanced diet, maintaining a healthy weight, and engaging in regular physical activity can help manage blood sugar levels. A diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats, while low in added sugars and saturated fats, is recommended. Additionally, aiming for at least 150 minutes of moderate intensity exercise per week can improve insulin sensitivity and overall health. Number 2, blood sugar monitoring. Regularly monitoring blood sugar levels allows individuals with diabetes to make informed decisions about their treatment and lifestyle choices. This can help prevent sudden spikes or drops in blood sugar and keep levels within a healthy range. 3. Medications. Various medications are available for treating diabetes. For type 2 diabetes, these may include oral medications that decrease glucose production, increase insulin sensitivity, or stimulate the pancreas to release more insulin. Type 1 diabetes always requires insulin therapy, as the body cannot produce enough insulin on its own. 4. Insulin therapy. Insulin injections or insulin pumps are a crucial part of treatment for individuals with type 1 diabetes, and may also be necessary for some people with type 2 diabetes. Different types of insulin are available, such as rapid-acting, short-acting, intermediate-acting, and long-acting insulin. The choice of insulin type and dosage depends on factors like blood sugar levels, lifestyle, and individual needs. 5. Regular medical checkups. Regular visits to healthcare providers are essential for monitoring diabetes management and detecting any potential complications early on. This may include routine blood tests, blood pressure monitoring, foot exams, and eye exams. By employing these strategies, individuals with diabetes can effectively manage their blood sugar levels and minimize the risk of complications. In the next section, we'll investigate the impact of diet, exercise, and stress management on diabetes management and prevention, highlighting the importance of a holistic approach to overall health and well-being for those with or at risk for diabetes. In this final section, we'll investigate the impact of diet, exercise, and stress management on diabetes management and prevention. By taking a holistic approach to overall health and well-being, Individuals with or at risk for diabetes can greatly improve their quality of life and reduce the likelihood of complications. 1. There's diet. A balanced and nutritious diet is crucial for managing diabetes and preventing its onset. Consuming whole, minimally processed foods, such as fruits, vegetables, whole grains, lean protein, and healthy fats, can help regulate blood sugar levels. Additionally, it's important to limit added sugars, saturated fats, and excessive carbohydrate intake. Proper meal planning and portion control are also essential to maintaining your healthy weight and managing diabetes effectively. 2. Exercise. Regular physical activity has numerous benefits for individuals with or at risk for diabetes. Exercise can help improve insulin sensitivity, lower blood sugar levels, reduce the risk of heart disease, and promote weight loss. Aim for at least 150 minutes of moderate intensity aerobic exercise per week, along with strength training exercises at least twice a week. Always consult with a healthcare provider before starting a new exercise regimen, especially if you have diabetes or other health conditions. 3. Stress management. Stress can have a significant impact on blood sugar levels. When the body is under stress, it releases hormones that can cause blood sugar levels to rise. Learning to manage stress through relaxation techniques such as deep breathing, meditation, or yoga can help maintain stable blood sugar levels and overall well-being. Additionally, getting adequate sleep and maintaining a strong support system can contribute to effective stress management. By incorporating these elements into a holistic approach to health and wellness, individuals with or at risk for diabetes can better manage their condition and prevent complications. It's important to remember that each person is unique, and what works for one individual may not work for another. Collaborating with healthcare providers and other specialists to develop a personalized diabetes management plan is key to achieving optimal health and well-being. In conclusion, understanding the different types of diabetes, their causes, and how they affect the body's use of glucose is vital. By taking a holistic approach that includes diet, exercise, and stress management, individuals can effectively manage diabetes and prevent complications, promoting overall health and well-being.